GBS News 9. The Ministry of Health now says the first patient to contract Mpox has recovered, according to an update issued this afternoon by Public Health and Professional Standards Principal Secretary Mary Muthoni. The patient has been under close scrutiny and treatment, with the ministry officials studying the case and its infectious rate. Speaking at the Ministry of Health headquarters in Nairobi, flanked with technical officials dealing with Mpox in the country, Principal Secretary Muthoni said the ministry's antennae had been raised with the surveillance heightened at border points, especially those with Congo, where the disease came from. In noting the recovery of the patient zero, the ministry has, however, insisted on a raft of measures to be adhered to in order to tame the spread of the disease, as well as heighten border patrol.
Health and Professional Standards, Ministry of Health, released on 6th of August 2024, and it's an update on Mpox outbreak. Our port health officers identified a truck driver with a generalized rash at Taita Taveta stop border point on 23rd of July 2024. He reported having symptoms of 2 weeks prior. The patient was isolated at Taita Taveta Sub-County Hospital, where the clinicians suspected either chickenpox or Mpox. Skin lesion samples were taken. Results from the National Public Health Laboratories detected Mpox on 29th July 2024. This was validated by other reference laboratories in the National Laboratory Network. The patient has since recovered. However, due to the infectiousness of Mpox and as per international guidelines for Mpox response, the Ministry of Health and the County Health Department of Taita Taveta began identifying all persons that had been in close contact with the patient. We are tracing all his close contacts at his workplace, at the hospital where he was admitted, and along his travel routes. So far, no other case has been identified in the country. The patient has traveled through Uganda, Kenya, Tanzania, and Rwanda. So we are working with our neighboring countries to identify any contacts and any other potential cases. There is an active Mpox outbreak in DRC, Burundi, Rwanda, and Uganda. Other response measures the Ministry of Health has continued to undertake include the ministry has deployed a rapid response team to support the affected counties with detailed investigations. The ministry has also activated the public health emergency operations centers across the country. Incident management teams have been established to coordinate response activities. The ministry is monitoring the evolution of the outbreak in our neighboring countries to assess the risk of regional transmission and appropriately adjust our response measures. All counties have been advised to sensitize the public on the outbreak and requisite preventive measures necessary to avoid contracting the disease, and also the steps to take when they contract the disease, including frequent hand washing with soap and water or hand sanitizer, seeking treatment early when infected, and avoiding close contact with sick persons. The ministry has provided emergency hotline numbers for the public to report suspected cases and seek further information on the outbreak. The numbers are 719. Second number is 0729 471